Lots of people are wearing face masks now that the federal government advised it. It was almost overnight, but less than a month ago, our Surgeon General said that, and I'm quoting, they're, quote, not effective in preventing the general public from catching coronavirus. I mean, should there be accountability there and also for the HHS Secretary?
Well, I don't know. Would anybody like to speak about it? I think, just so you understand, if somebody wants to wear them, I'm all for it.
I actually appreciate you asking that question because it's one that that we've had to clarify several times, and I understand why the American public has been confused over time. As Dr. Redfield mentioned, initially we said, based on CDC, World Health Organization, and most other major public health organizations, that the public needed to know that these masks were not effective or shown to be effective in preventing you, if you wear a mask, from catching coronavirus. Another important thing to remember is the context of those statements was a run on medical masks, on N95 masks, and our healthcare workers were at risk. What's changed? What's changed is we found out that unlike past viruses that are spread through the respiratory route, a significant proportion of coronavirus cases can be traced back to asymptomatic spread. So, the task force deliberated this. We've always told you that we will look at the facts and we will give people recommendations based on the best available evidence at the time. And once we saw that asymptomatic spread, we said, well, masks still aren't effective, and from our point of view at preventing you from catching coronavirus in a significant way. But we've always told people that they should wear masks if they know they have symptoms to prevent them from spreading to other people. Well, now that we know about 25 to 50% of people are spreading asymptomatically, we suggested people wear cloth facial coverings to prevent asymptomatic spread. You wear your mask to protect me. I wear my mask, and Dr. Redfield mentioned it. I've got my mask. I believe I have mine on me, Bob. I carry mine around with me, too. I wear my mask to protect you. We're 6 feet away, which is why I'm not wearing my mask to protect you now, and we also all have been tested. So that's why I'm not wearing mine now.
Yeah, but I'm right next to you.
Well, I'll put mine on if you want me to, sir. But again, important to know that if you're going to wear a mask, it's not a substitute for social distancing. Still, social distancing is the number one thing you can do. Number two, it's important to know that you should practice good hand hygiene and not touch your face, because you still could touch a surface and bring disease to your face. And number three, this is the most important, well, it's just as important, please save the medical mask, the N95s for the healthcare workers, because the cloth facial coverings are effective, as far as we know right now, based on the best available evidence, at preventing you from spreading disease to other people. So no inconsistency there. It's just the recommendation changed because the information changed, and that's what you want from your public health leaders.
And the argument made that you knew about asymptomatic transmission at the time that you said that, and that you were essentially misleading the public so that they
Well,
He's
mean,
answered that question.
the honest answer to you is no, we did not. That was the recommendation of the World Health Organization and the CDC, and we gave you the best information we could at the time. So I actually a little bit resent that implication, because I work hard to try to protect the American people, and we are always going to give the American people the best information we have available at the time. And we're humble enough to say, look, if we don't know, we're going to change. We're going to change those recommendations.
Just a wise guy question, that's all.